When he's not at Warwick Medical School, this is where Professor Cook spends his working week. It's the Accident and Emergency Department at Birmingham Heartlands Hospital. It's one of very few hospital departments in the country to have experimented with lean healthcare. Professor Cook, who's a consultant here, has been instrumental in introducing it. I started by asking him what exactly he understands lean healthcare to mean.
Lean's a principle that came from manufacturing industry about how they could produce things more efficiently. Particularly Toyota was the start of that. And it was really about getting rid of waste in the system, working more efficiently. But that's not the old cutting things right back to the bone. It's actually working in a way that every step of the process adds value for the patient.
As you say, it started in Japan, but it has spread around the world.
Yeah, it rapidly spread within the car industry over to America when they realised that the Japanese were doing everything cheaper and better. And now there's all sorts of industries, and perhaps the one that's always quoted in the United Kingdom is Tesco's using it so that they get their supplies delivered just in time to have them taken off the shelves without too much stock on board.
Now, you've introduced lean healthcare principles here at A&E. What have you done?
Well, the first area was the treatment with people who walked in with less severe injuries. They used to go through a process where they were seen by a nurse who sorted them as to how long they'd have to wait. Then they'd see a series of doctors and nurses before they were sent home. Now it's down to two people. They come in, see a receptionist, see a nurse practitioner, go home. So one person does it all and therefore gets rid of a lot of the wasted time for the patient and prevents errors, because handing over between doctors and nurses, bits of information get lost. So it's not only a faster system, it's actually a safer system as well.
So what differences have you noticed?
The most important difference is from the patient's point of view, they get seen much more quickly and they're in and out of the department having had appropriate treatment. Perhaps the dramatic aspect of that is when you walk into the waiting room, it used to be that rows and rows of seats of people waiting there. Now there's often only 2 or 3 people when I walk in the morning rather than 40 or 50.
And now there are plans to transfer these principles to other departments in the hospital.
And it's not just the clinical departments. Yes, there are some areas such as the X-ray department and the pharmacy where we're taking out all these steps that didn't actually add value. But it's also the finance department. Getting it so that when a bill comes in, it's paid there and then. And it's even down to personal aspects. You know, how you deal with your own email. You can be lean in that approach, so you only read each email once and just deal with it. We all tend to say, oh, I don't want to do that at the moment, and read emails 4 or 5 times. And that's incredibly inefficient.
We've heard quite a bit of late about the NHS being in crisis, having a bit of a funding crisis. Is this the answer?
Places that are adopting it are finding that it just is a superb solution. It improves the timeliness of care, it improves the quality of care, and it also reduces the cost. And people just don't believe it when they hear that. But I think the answer is just go and look at the places that are doing it. It does work, and yes, it reduces costs and improves the service at the same time.
I can imagine some staff being sceptical, saying, it's all very well for the car industry, but this is a hospital. Have you had any resistance?
We've certainly had people who believe it's going back to the old style of cuts. And it's a matter of speaking to those staff and them understanding that what we're saying is, yes, we are going to remove certain parts of the process, but only the parts that don't add value for the patient. And so we're going to actually make it better for the staff, because they will actually spend more of their time on direct patient care. We make it better for the organisation, working more efficiently, and most importantly, we make it better for the patient. They get their care in a timely way that is safer and better.